MyoFascial Disruption Technique. It's a really great technique about learning how to deal with fascia, learning how to deal with trigger points, different fascial problems, and just more about fascia in general, right? So fascia it's a type of connective tissue that's inside of your muscles, around your muscles. It forms your tendons. It is a whole lot of our body is made up of connective tissue, and a lot of it is actually fascia too. So we're going to demonstrate what fascia does by just kind of showing you with a little glove here, right? So I know I'm wasting PPE, sorry. Anyway, this glove is essentially like fascia. It's surrounding your muscles here, right? And when your muscles move and bend, it's kind of sliding over the muscles, helping them move and work like they need to. Fascia also has a bunch of nerve fibers in it, and this provides your brain something called proprioception, which helps your brain to be better at activities, better at movement, helps you to maintain your balance, helps you be better at sports, right? It's kind of knowing your brain, knowing exactly where your finger is in space. It comes from muscles, joints, nerves, and then also nerve fibers in the fascia itself, right? So with fascia, should move nice and smoothly. The more you exercise, usually the more healthy the fascia is. The more you have bad posture, the more the fascia will adapt and actually get used to this posture and become tighter, say, in the front and looser in the back. So fascia-wise, imagine we had an injury, right? The fascia kind of got pulled tight. Maybe it's a little knotted up down there. And what happens is, that pulls on my fingers here. All of a sudden, it becomes a struggle to straighten my fingers out, especially my thumb here is really hard to do, right? This will cause pain fibers to fire from this. You'll have a painful condition. You'll have poor range of motion, poor mobility. And what we're gonna do is we're gonna get in there and we're gonna work the muscle. So in this case, I could use either acupuncture needles, I could use my thumb and just kind of work that point out and get it moving better. And then we retest and we're like, okay, motion's better, there's less pain, okay? Now the one difference with this technique is sore. It's not so sore when I do the needling, that's actually pretty comfortable. But if I go in there and I gotta physically kind of correct that herniated trigger point or whatever's bothering you, I'm using a fair amount of pressure. So it's gonna hurt like the dickens for 5 to 30 seconds while I'm doing my pressure on you. But then right after that, we can go back to the activity that used to hurt you, and usually you'll get a vast reduction in pain. So it's pretty fast results, but it kind of sucks the moment you're doing it, right? So you feel that pain for a little bit, and then boom, relief, okay? So this is not for everybody. Some people can't handle it. Some people just can't take the pain. Some people are on too much blood thinners and things like that. You all can't handle it either. So it's a great technique. I want to highlight a couple conditions that it's really supposed to be very good for, like getting things better in 1 to 2 visits, and helping people return to activity and play without even having to rest very much.